Hi everyone, this is Dr. Hamidreza. In the world of psychology, there are different types of personality disorders. This time, I'm privileged to talk to you about OCPD or Obsessive Compulsive Personality Disorder. OCPD patients are following the rules. Somehow, we can call them the people that are adherent of the rules and regulations. In this respect, I'm going to refer the types of the OCPDs and the symptoms of this kind of personality disorder. Now, the main question is, what are the symptoms of OCPD? Referring to symptoms, we can refer to the excessive devotion to work that impairs social and family activities, excessive fixation on lists, rules, and minor details, perfectionism that interferes with finishing tasks, rigid following of moral and ethical codes, unwillingness to assign tasks unless others perform exactly as asked, lack of generosity, extreme frugality without reason, holding behaviors. All of these are the symptoms of OCPD. Of course, if one has four of the mentioned characteristics, we can call the person as the one who suffers from this personality disorder. Of course, it should be taken into account that when we talk about personality disorder, we should take into account a spectrum that starts from the least amount, mild, moderate, and the high and extreme. And so it facilitates among these levels. The diagnosis of OCPD is made when these traits result in significant impairment in social work, family functioning. A person does not need to have all of these symptoms to have the personality disorder. In this respect, we should remember that if a person lifestyle and the way he deals with others is not impaired by these characteristics, there is high possibility that it is not a kind of personality disorder. What seems significant is the impairment, the distraction, or the sabotage that is caused by this personality disorder. People suffering from this kind of disorder are mostly brought up in families with rigid rules. The parents are mostly harsh. They are the adherents of the rules, regulations, formalities, ethical codes, disciplinary, and things like that make the life somehow difficult for their siblings and for their offsprings. Additionally, there are some questions regarding the difference between OCPD and OCD. It comes to the mind of many people that what are the difference between these two? People with OCD have insight, meaning they are aware that their unwanted thoughts are unreasonable. People with OCPD think their way is the right and best way and usually feel comfortable with such self-imposed system of rules. In other words, the person who suffers from OCD most of the time tells us that I know that the images that come to my mind are not real. They say that we know that the thoughts that intrude our mind are not reality. They are not based on facts and evidence. However, they consistently confirm the fact that they cannot prevent those thoughts, and they become stressful and they feel tense when these thoughts, negative automatic thoughts attack their mind. On the other hand, the people suffering from OCPD or obsessive compulsive personality disorder, they firmly believe in the righteous of their activities. They believe that what they do is based on reality, based on discipline, based on the standards. So they are rigid adherents of the rules and regulations. So we can say that they have very low level of the psychological flexibility. Additionally, the thoughts, behaviors, and feared consequences common to OCD are typically not relevant to real life concerns. People with OCPD are fixated with the following procedures to manage daily tasks. Often, OCD interferes in several areas in a person's life, including work, social, and family life. OCPD usually interferes with an interpersonal relationship, but makes work functioning more efficient. It is not the job itself that is hurt by OCPD traits, but the relationship with co-workers, even employees, can be strained. In other words, typically people with OCPD don't believe they require treatment. They believe that if everyone else is conformed to their strict rules, things would be fine. The threat of losing a job in a relationship due to interpersonal conflict may be the motivator for therapy. This is in contrast to people with OCD who feel tortured by their unwanted thoughts and rituals and are more aware of unreasonable demands that symptoms place on the others, often feeling guilty because of this. It should be taken into account that family members of people with OCPD often feel extremely criticized and controlled by people with this personality disorder. Similar to living with someone with OCD, being ruled by under OCPD demands can be very frustrating and upsetting, often leading to conflict. Now the question that comes to our mind is about statistics. How many people have OCPD? About one in 100 people in the United States is estimated to have OCPD. This statistics regarding Iran is almost 2 in every 100 people. OCPD is diagnosed in twice as many men as women. Many people have OCPD traits without having the fully diagnosed personality disorder. For sure, it's time to answer the question, which is what causes OCPD? What are the origins of OCPD? And what are the background factors that contribute to this personality disorder? There is no single specific cause identified. Several theories suggest that people with OCPD may have been raised by parents who were unavailable and either overly controlling or overprotective. Also, as children, they may have been harshly punished. The OCPD traits may have been developed as a sort of coping mechanism to avoid punishment in an effort to be perfect and obedient. It should be considered that genetics may play a significant role, but this has not been well studied. From a different perspective, cultural factors play a very pivotal role. Societies or religions that are very authoritarian and bound by strict rules may impact early childhood development that affects personality expression. A word of caution, not all rule-bound societies are dysfunctional, and OCPD traits may in fact be rewarded within the specific cultural or religious context. What are the treatments? Psychotherapy, cognitive behavioral therapy, CBT, and techniques that improve persons' insight, for example, psychodynamic therapy, can be helpful for some people. The goal is to lessen rigid expectations and learn how to value close relationship, recreation, and fun, with less emphasis on work productivity. Medicine, selective certain reuptake inhibitors, SSRIs, may be useful in addition to psychotherapy by helping the person with OCPD be less bogged down by minor details and lessen how rigid they are. Relaxation, specific breathing and relaxation techniques may be useful to reduce a sense of agency and stress that are experienced by OCPD. And finally, as the final word, the question is, what is the prognosis? There are few larger-scale studies for people with OCPD. However, reports suggest that treatment can help lead to greater insights into how someone with OCPD symptoms affect others. It often takes the threat of less of a relationship or job to motivate people with OCPD seek treatment because they typically don't think there is anything wrong with the way they are. If motivated to change, psychotherapy holds much promise. Thanks a million for listening to this podcast.